Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss about application of artificial lung respiration, that is ECMO support, and its usage in lung failure. Hello Dr. Archana. Welcome to our podcast for patients, caregivers, and healthcare professionals at Medica Talks. Dr. Archana, can you tell us what is artificial lung respiration?
Hi Urvashi. Although lung transplantation is an effective treatment for end-stage lung failure, its limitations have led to renewed interest in artificial lung support. For patients with lung failure, the use of ventricular assist device has significantly improved the quality of life and survival of patients with end-stage heart failure. In contrast, there are no devices that can be used long-term as destination therapy for end-stage lung failure. There is a strong need for them. Extracorporeal membrane oxygenation is widely used as a temporary treatment for acute lung failure and as a bridge to lung transplant. Many patients with advanced lung failure cannot return home with good quality of life once they are hospitalized. Artificial lung devices are membranous, made of synthetic material that are connected to blood vessels through tubes and cannulas of silicone. The blood passing through the device is oxygenated and cleared of carbon dioxide.
What is ECMO?
Extracorporeal membrane oxygenation, that is ECMO, is a life-supporting machine. People who need ECMO have a severe and life-threatening illness that stops their heart or lung from working properly. For example, ECMO is used during life-threatening conditions such as severe lung damages from infection or shock. After a massive heart attack, the ECMO machine replaces the function of heart and lungs. People who need support from an ECMO machine are cared for in a hospital's intensive care unit. Typically, people are supported by an ECMO machine for only few hours or days, but may require it for a few weeks. Depending on how their condition progresses, there are many overlap and differences between the use of ECMO in children and adults.
Why is ECMO used?
ECMO is used to help people whose lungs cannot provide enough oxygen to the body even when given extra oxygen. Lungs cannot get rid of carbon dioxide even with the help from a mechanical ventilator. Heart cannot pump enough blood to the body. ECMO may also be used to support people with heart or lung diseases that cannot be cured while they wait for an organ transplant. Example, new heart and lungs.
How does an ECMO machine work?
The ECMO machine is connected to a patient through plastic tubes, that is a cannula. The tubes are placed in large veins and arteries in the legs, neck, or chest. The procedure by which a healthcare provider places these tubes in a patient is called as cannulation. The ECMO machine pumps blood from the patient's body to an artificial lung oxygenator that adds oxygen to it and removes carbon dioxide. Thus, it replaces the function of person's own lungs. The ECMO machine then sends the blood back to the patient via pump with the same force as the heart, replacing its function.
How long is an ECMO machine used?
An ECMO machine can help save a person's life, but it does not treat the disease or an injury that leads to heart failure and lung failure. An ECMO machine simply provides support to a person while the healthcare team works on treating the underlying diseases or injuries such as infections or until organs for transplant becomes available. Healthcare providers will always try to help people get off the ECMO machine as soon as possible. Some diseases or injuries can be treated quickly, and patients only need the ECMO machine for a few hours.
Are there any risks being on ECMO machine?
The healthcare team always aims to avoid any complication that may occur from being on ECMO. Some of the more serious problems that may occur when a patient is on ECMO includes bleeding, infection, kidney failure, leg damages.
How does a person get taken off ECMO?
The ECMO machine supports the person while he or she tries to overcome a disease or injury. If the disease or injury improves, the patient may not need the support of the ECMO machine anymore. The healthcare provider will slowly reduce the amount of support the ECMO machine provides to see if the patient will be okay without it, just like they do with a ventilator.
Thank you, doctor, for being a part of Medica Talks and sharing your insights. We are hopeful that this informative talk has enlightened the listeners on how ECMO works and its benefits.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the